Welcome back. So this is the third out of our 4 videos on the anatomy of the female reproductive system, and today we're going to cover the blood supply. The way I figured I'd teach this is we're just going to draw it out together first, and then I'll tell you how I suggest memorizing it. I guess we may as well start where all of blood starts, which is the heart. So, can anyone tell me the name of this big vessel that comes out of the heart and carries oxygenated blood to the rest of the body? That's right, it's the aorta. Alright, and can anyone tell me how the aorta ends? What is the terminus of the aorta? That's right, it splits into a left and right common iliac artery. Hey, if you're not getting these, it's probably worth going back and just reviewing your notes from first year before you come back to this. So, moving on, my next question, of course, is how does the common iliac artery end? Here's a hint for you. Anytime in anatomy you see the word common, it usually means something's about to split into an internal and an external branch. Like, you might know that the arteries that go up the neck are called the common carotid arteries. Well, they eventually split into an external carotid, which supplies the face and scalp, and an internal carotid, which goes in to supply the brain. So the same thing happens here in the pelvis. The common iliac arteries on both sides each splits into an internal iliac and an external iliac. Now from here on out, I'm just going to draw in the right side, just so it doesn't get too cluttered on the screen, but just remember that this is happening symmetrically on both sides of the body. Now the external iliac artery eventually goes down the leg to supply all of the musculoskeletal structures of the leg, and it continues as the femoral and popliteal arteries. But because we're here to talk about the reproductive organs, we don't really care about the external iliac today. Instead, we're going to focus on the internal iliac artery, which comes inwards to supply all the organs of the pelvis. The internal iliac artery splits into an anterior and a posterior division. Now, there is some amount of anatomical variation, which means that different textbooks, and indeed different patients, will have slightly different combinations of this anatomy, but I'm going to teach you the one that I was taught in second year, which is that there are 6 branches coming off of the anterior division and 3 branches off the posterior. Now, we're going to go over them one at a time and talk about what each one supplies. But as we do this, I just want you to bear in mind one very important principle, which is that the name will usually tell you what it does. For example, starting with the posterior division, the first branch is called the iliolumbar artery. So just based on that name, what do you suppose it supplies? Well, obviously it supplies the ilium bone, as well as some of the muscles around the ilium bone like the iliopsoas, and some of the structures of the lumbar back like the quadratus lumborum muscle and the cauda equina. The second one is called the lateral sacral artery. So, who would have guessed? It supplies the sacrum. The third one is called the superior gluteal artery. Now, you'll remember from your MSK block that the superior gluteal nerve innervates the gluteus medius, minimus, and the TFL. So the superior gluteal artery supplies those exact same structures. And of course, if there's a superior gluteal artery, then, well, jumping to the last branch of the anterior division, it's going to be the inferior gluteal, which supplies indeed the gluteus maximus, as well as some of the structures around it, like it penetrates through the piriformis and the ischio-coccygeus and gives off branches to those muscles, and it also supplies the top of the hamstring, because that's right next to where your gluteus muscles are, right? Alright, now let's actually go back to the start of the anterior division. The first branch is called the umbilical artery. This one's really interesting actually because this is actually the artery that in a fetus would go out through the umbilical cord to the placenta to receive oxygen. After birth, you obviously don't need an umbilical cord anymore, so what happens is the distal part of this artery sort of shrivels up into this ligament known as the medial umbilical ligament. But the proximal part still stays patent, and that's because there is an important branch that comes off of it called the superior vesical artery. And I've said before that vesicle in anatomy means bladder, so the superior vesicle supplies the top or the fundus of the bladder. Moving on, the second branch of the anterior division is called the obturator artery. Now, you recognize the word obturator from some of the medial thigh muscles, and so this is going to be the artery that supplies a lot of the pelvic and medial thigh muscles, and it also gives off a branch to the head of the femur. The third artery coming off of the anterior division is the uterine artery, and the uterine artery actually splits into 3 branches, an ascending branch, a descending branch, and a vaginal artery. Now, like I said earlier, there's some amount of anatomical variation, so you will find some textbooks and some lecturers who say that the vaginal artery comes directly off of the anterior division, whereas some people say it's a branch of the uterine. But in any case, the ascending branches supply sort of the top of the reproductive organs, so the ovaries and fallopian tubes and the top of the uterus. The descending branch supplies more the bottom part of the uterus, so the cervix basically, and the upper vagina, whereas the vaginal is the lowest branch. It goes and supplies the lower vagina and some of the surrounding structures like the urethra, and lower bladder, and the vestibular bulb. Next, we have the middle rectal artery, which, as the name implies, supplies the middle part of the rectum. Now, the rectum actually has three sets of vessels supplying it: superior rectal, middle rectal, and inferior rectal. Now, the superior rectal you will learn about when you do your gastrointestinal anatomy block, because it actually comes off a branch of the vessels that supply the intestines, so it supplies from above. The middle rectal is this one here, and the inferior rectal we'll talk about in just a sec. So what is this fifth branch of the anterior division? It's called the internal pudendal artery. Now, the word pudendal comes from a Latin word which means that which must not be spoken of. So it supplies all of your private parts, basically. It eventually splits into the inferior rectal, which I mentioned earlier, supplies the bottom of the rectum, and the perineal branches, which goes and supplies some of the structures around the perineum, the external genitalia and your urogenital triangles. And that's it. That's literally all the branches of the internal iliac artery. And like I said earlier, if you just think about the name, it will almost always tell you what it does. We're nearly done. There's just one more detail I want to add, which is that the ovaries, I mentioned earlier, received some blood supply from the ascending branch of the uterine artery. Now, that's not actually where the ovary gets most of its blood supply. There is actually an artery called the ovarian artery, which comes directly off the aorta and comes down through the suspensory ligament of the ovary and supplies the ovary from above. So you might be thinking, well, that's all fine and good and everything, but how am I actually going to remember all of this? Well, I would recommend that you make 3 flashcards, just 3. The first one, which is to get from the heart to the 2 divisions of the internal iliac artery. The second one asks you to name the 6 branches of the anterior division, and the third one asks you to name the 3 branches of the posterior. That way you'll be able to first draw the map leading to all of the vessels, and then populate it with all the names. And then if you consider that the names usually tell you what it does, you will then be able to figure out what each branch supplies. So if you just commit those 3 flashcards to memory, and they're not big flashcards, then you should be able to reconstruct this diagram all from memory. That's it for blood supply, but I wouldn't really be allowed to make a blood supply video without also touching on lymphatics and nerves. It's sort of a package deal. So here we go. Revision point 3C. No one cares about lymphatic drainage. Okay, that's not entirely true. Oncologists care about lymphatic drainage, but look, it's not very complicated. For the most part, it matches the blood supply, including the fact that the ovaries drain to the para-aortic nodes in the same way that they're supplied directly from the aorta via the ovarian artery. So a tumor of the ovary, or indeed the testis in men, would usually metastasize first to the para-aortic nodes. So yeah, it mostly matches the blood supply. And if you really want to learn exactly what drains to where, just memorize this table that I've provided here. And lastly, just to cover innervation, revision point 3D. No one cares about autonomic innervation. But if you really want to know, the autonomic nervous system is subdivided into the SNS and the PSNS, right? And the uterus has to get a combination of both. And you might remember from first year that the SNS is said to be thoracolumbar in origin, which means all of the SNS nerves come from either the thoracic or lumbar region. And the PSNS is entirely craniosacral, which means all the PSNS nerves either originate from the cranial nerves or from the sacral nerves. Now, the uterus gets all of its SNS and PSNS input via the uterovaginal plexus, which in turn gets its SNS component from the thoracolumbar nerves via the superior hypogastric plexus, and it gets its PSNS component directly from the sacral nerves. And that brings us to the end of blood supply, lymphatics, and nerves. So keep an eye out for our next video. We'll be covering the muscles of the pelvic floor.